When a migraine hits, I describe it as having Godzilla play soccer with my head. It's overwhelming pain. It feels like I'm being crushed.
Physicians often feel powerless or frustrated when they can't help a patient who has very severe headaches. And I think it's important for them not to underestimate the role they can still play in the care of a patient like that.
Migraine is a big issue. It's underdiagnosed and undertreated and very common. It's the most common neurologic condition in the world, yet very disabling, which is something that people have a hard time understanding, that something could be so common and yet so troubling at the same time.
I think for most people, migraine is best viewed as a chronic illness. It's a condition of long duration. It often appears for the first time in late adolescence or early adulthood, and for the majority of people, it is intermittently a problem through their 50s or 60s.
I think I had my first migraine at about age 22. The first time I remember having a headache that was so bad I wanted to curl up and lie down and not talk to anybody. And I would take different over-the-counter things that were available at the time. And sometimes I'd get a clump of them in a few weeks or a few months, and then I might not be too terribly bothered.
We know from studies done in primary care, for example, that among people who present with headaches, the majority of them, when they're followed over time and keep headache diaries, turn out to have a diagnosis of migraine.
Also, many people will come to the office seeking care saying, my migraine started 5 years ago, and they're a person in their 30s or 40s, when in fact that's when things started to get bad. And if you really push them, they say, yeah, when I was a teenager, if things were very stressful or I didn't get enough sleep, every once in a while I'd get a migraine. So age of onset is kind of murky water because people don't even realize sometimes those headaches they had years ago were in fact migraines. Maybe not the full-blown, frequent, and intense migraines they're having now, but they were migraines by definition.
I was under the impression that migraines meant you got these weird visual disturbances, or that you were vomiting, or when I grew up, people used to throw the word migraine around like someone's malingering or making it up.
I think viewing migraine as a recurrent sick headache, if you will, something that is more than a mild headache, often associated with nausea, and recurrent, leaving them normal in between, and threatening their activities at times.
Patients will have sensitivity to light and sound. They can have a visual aura that precedes the headache. That only happens in actually about 20% of patients. And there's a lot of misconception about that. But oftentimes patients will have other symptoms as well. Mental fogginess, fatigue, sleepiness, sensitivity when they touch their hair or when they touch their face. All of these symptoms can be described with migraines.
As I got into my early 40s, they escalated. They got worse, they got closer together, and they got more severe. Until one night, I crawled to where my phone was in the living room because I thought I was having a stroke. And I couldn't walk very well. I was in so much pain and so weak. I crawled and called 911, and the police came and an ambulance came and took me to the emergency room, and that's where they diagnosed it as a migraine.
Migraine is more common in women than men, but it's still very, very common in men as well. And I think sometimes we lose sight of that. Migraine is often viewed as principally a women's disorder, and while it does affect women to a greater extent than it does men, men also can have migraine, and fairly severe migraine as well.
One mimic that we often see is confusing migraine with sinus disease. They actually look very different, but it's easy to confuse them.
Many studies have actually shown that well over 95% of sinus headaches have nothing to do with the sinuses at all. I often tell people, if you're convinced that it's a sinus headache, you should have a fever, you should have some thick, infectious, purulent-looking discharge coming from the nose, and if neither of those are present, it's more likely than not a migraine. The other side of the coin is that if you do have a sinus headache, light shouldn't bother you, noise shouldn't bother you, and you really shouldn't feel nauseous either. Those would be very uncommon for a sinus headache.
I think your suspicion that you're dealing with migraine should be heightened when you have a patient in front of you who experiences headaches that disable them, that keep them from doing what they would like to do. Missed work because of a headache. Those are all signs that you're dealing with a more severe than just an average headache disorder.
Having chronic migraines sets off a cascade of consequences that I think a lot of people don't understand. It can turn you into feeling like you're a beaten puppy. It is demoralizing and unsettling to realize that you're not safe from your own body.
Hi, my name is Kelvin and I work on the team that creates the content that you've just seen, MedscapeTV. If you like the content and want to see more, click on the button to the right and it'll take you to the full series.